Hello and welcome everyone to another Association of Natural Health webinar. We're glad to have you here with us this evening. Um, Oops, got to turn that off. Just excited to have you guys here with us tonight. We have a very special webinar with a new presenter joining us. Tonight we have Andrea Warrach, and she's going to be presenting the root cause roadmap, a systemic approach to the health challenges and optimization. So glad to have her joining us this evening. A couple of announcements I'd like to make. One, if you look at your control panel, you'll notice that there are a couple of icons. You'll see one that looks like a chat message. You can use that to send messages to me. There's also a question, one that has a question mark with it. That's a drop down or pop out. You can do it either way. And you can submit your questions for Andrea as we get going. There's also a section on there where you should have the ability to get what's called materials. So if you look for the one that has the paperclip icon and click on that, you'll see that we've provided you two downloadable items for this evening. So make sure you check those out. And let me just real quickly provide you with the disclaimer. This material is intended to provide general information, including opinions and recommendations are for educational purposes only. Such information is not intended to be a substitute for professional medical advice, diagnosis, or treatment. We're not providing any clinical care or specific directions related to that. If you do have any issues, please see a qualified physician. Now, let me introduce this wonderful woman who's joining us this evening. It's Andrea. She's an integrated holistic analyst and certified health coach with a Bachelor of Science and additional specialization in functional nutrition, advanced functional testing, and nutraceutical support. As the founder of Art Etra, she works at the intersection of functional medicine, diagnostics, and individualized care, believing that every person's biology, history, and goals deserve a truly personalized approach. Her philosophy centers on looking beyond surface level symptoms to better understand the underlying patterns behind a client's health picture using data driven tools alongside compassionate, collaborative guidance. And she's dedicated to helping clients build vitality, resilience, and balance as part of a lifelong wellness journey. So, welcome, Andrea, and I'll let you get started.
Fantastic. Thank you so much, Trey, for that amazing introduction. So, good evening, everyone. I'm so excited to share my root cause roadmap thoughts with you. And I am an independent health coach, but I work with clients straight on, and I also work with practitioners. And one of the clients I work with is Zanfini Wellness Center with Dr. Stephen Zanfini, and we do a lot of this root cause roadmap work together. So here is my cover, which I think you can see. And I'm going to start going through the slide deck. We have a lot of slides and we have a lot of information, and I'm going to do my best to get it all across to you. Okay, let's see. So here we are with standard enzymes, and I love this practitioner grade products because there's a lot of things I look at before I use a product line. And one of those things is, are the raw materials tested? And here they do. They test for potency, purity, and heavy metals. And especially if you're dealing with anything to do with the brain or the nervous system, you really want to be careful about heavy metals. And when herbs are sourced from all over the world, we really don't know if that field is being watered from a mine from a heavy metal mine, and now you have a product with heavy metals in it. So I love that they do that. And they also test every single finished product and keep some in stock if anything needs to be retested. So I love that accountability. And then looking at the actual products, anything with medicinal mushrooms in it, I always do my due diligence and look at the mushroom mycotoxin reports from the companies, and they really do all of their testing for mold so well. Mold is one of the things that I work with, so I'm really careful that I'm not giving it to the people that I'm working with. Anything derived from animals, either bovine or porcine, should really be organic, grass-fed, pasture-raised, and that is what Standard Enzyme does. And the bovine comes from New Zealand, which is a great source. In addition, they use the sporadic method to extract their herbals, and that's an amazing method because it has very pure and very bioavailable extracts. And it is expensive, but I love that they spare no expense. The way that you can look at that product line is that the orange labels are herbals, the green labels are homeopathic, like this right here, and the blue labels are include vitamins and herbs. So it's a really nice way that they dealt with that. Okay, so here is our roadmap. So we're going to start at 1, which is on the bottom. 1 is really important because it is the base of your pyramid of your strength on your road to optimization. And it deals with fuel delivery. So is your body and your brain and your cells getting oxygen? What is the blood sugar doing? Because glucose and oxygen are the most important things for energy and brain. How is the digestion working? Because if you're eating the right things, but the digestion isn't actually happening properly, then you're not being able to extract everything out of the food that you eat. And again, how is this all affecting your cellular energy? So here's some details. So here's oxygen and blood pressure. So for oxygen, I like to look at serum labs. I like to really look at the CBC and the iron panel together and do an in-depth analysis because there's many different types of anemia. And also when you see low red blood cells, you have to ask yourself, is the issue a production issue, a destruction issue, or a loss issue? Meaning, is someone having internal GI bleeding, or is a woman having really heavy menstrual cycles that's affecting her blood count? So those are really important things to look at. Now we go into the delivery of the actual blood pressure. And high nor low is favorable because think about if you have high blood pressure, that's like having a very fine tube with a fine mist coming out of it. How are you going to do any detox? How are you going to do any delivery with this fine mist? Whereas low blood pressure is like a big hose with a dribble coming out of it. Again, no detox, no delivery. So I often find a lot of low blood pressure with people that are having some chronic conditions going on. So these are some of my protocols that I use. I have them do 1 teaspoon to 1 tablespoon of gray Celtic sea salts. You can use other salts as well, just not Morton's. Gray Celtic does have some minerals in it, and that is something to be considered. Then I add in cayenne and true aerobic zone exercise, only for 15 to 20 minutes, 3 to 5 times a week. I so find people that are over exercising, and we'll be talking about that a little more, because if someone is not having good fuel delivery and then taxing their system by over exercising, how is the body going to have any energy to do anything else that you're asking it to do? I also have people wear wearables to track their pulse during exercise, and that is really, really helpful. And I show them the calculation for the true aerobic heart rate. So you take 180 minus the age of the person, and that would be, for this person, that's 53 on the sheet, that would be 123 would be their highest heart rate. And then you subtract 10 from that, and that's the lowest heart rate. So they need to keep their heart rate between 123 and 113 for 15 to 20 minutes, 3 to 5 times a week. It's not better to do more, and I often have to be careful that people aren't overdoing it. Okay, here we are, blood sugar. So blood sugar is very important along with the oxygen. So I do a metabolic program, and I love to use the Freestyle Libre 3, which is right here. It's a CGM, which is a continuous glucose monitor. And with that, I really teach people about understanding their nutrition, their activity, their sleep, their stress, and even the gut microbiome influence on their metabolic flexibility. And as they learn that, it really helps them meter what they're doing. And I also teach that this is a moving target because as you age or as you hit different lifestyle challenges, this metabolic flexibility can change. And for women, it definitely changes over perimenopause and menopause. So that's a really important time to get a really good understanding of this. After that, I'd like to do some ketosis work wherever needed. This is a Keto Mojo monitor. It's a finger prick method, and that hooks to your phone, and it does the GKI formula that's written here on the slide. And the GKI is a great way to tell if you're really in ketosis and how high that ketosis level is. So if your GKI is over 9, you're not in ketosis. Low ketosis between 6 and 9, moderate ketosis between 3 and 6. I'd like to keep people under 2.5 for sure, but it's a really great way to get weight loss going and reversing things like type 2 diabetes, insulin resistance, obesity, metabolic and endocrine disorders. I mean, once I get people moving on this, it's a really amazing way to help people. So here we are at fuel delivery and digestion, because if poor digestion is happening, then how is your body breaking down the food and getting the essential nutrients? And when that's not happening, your cellular function slows and your overall energy reduces. So this is really important for people that have fatigue. And I see a lot of people like that. So I love to use Alpha Gest, and I love to use Alpha Gest 3. The reason I love Alpha Gest 3, if I also see there's problems with liver and gallbladder, that's a great thing to add on. And the Alpha Gest, I love to use betaine and pepsin to prime the stomach acid. And you can see these type of chronic fatigue issues with digestion come up on the GI map, looking at the secretory IgA, and also the Dutch Plus, looking at the HVA and the VMA, which refers to dopamine metabolites and epinephrine and norepinephrine metabolites. So I also do some home testing to look at stomach acid, but this is really something that I am very passionate about correcting for people. And there's a lot of lifestyle stuff that people need to consider when they do this, because they shouldn't be doing antacids or PPIs, proton pump inhibitors, and your digestion really starts in your brain. So, looking at the beautiful colors of the food, hearing the bacon hit the pan and sizzle, and smelling it, all of that signals to your brain to start producing stomach acid. So, driving down the street, deciding you're hungry, pulling over at McDonald's and shoving a Big Mac down your face, your body didn't even know that was coming. So that is a double problem there, because no one should be doing that McDonald's stuff anyway. But one of the other vitamins I like to look at for fatigue is vitamin D. And I really love the standard enzyme vitamin D3 and K2 combination, because that K2 really makes sure that the calcium is going in the right places when it's being absorbed. So instead of just, collecting in the arteries, which we really don't want. All right, let's continue talking about fuel delivery and energy. So one of my favorite things to look at here is the brain. So when people are telling me they have brain fog, I know that they have some deficiencies in minerals and vitamins, and I love pumping it up with some good vitamin Bs. If I do know that someone has an MTFR gene SNP, then I definitely make sure everything's methylated. And even if I don't know, if I can't get them tested, it's better safe than sorry to use high quality methylated Bs, which is exactly what standard enzyme offers. And I love, you can see on the screen all the different Bs that are in these liquids. And a liquid is great because it's very, very bioavailable. And then I also love the TMPH enhancer, because that's 72 ionic trace minerals, and that's a great way to get minerals in. So let's go back and talk about the digestion and the brain. So the brain uses 20% of the body's energy. And if the digestion is off, then how are the nutrients for required, the nutrients for required neurotransmitter synthesis and mitochondrial ATP production actually happening? So the brain is really on the top of my list. That's one of the reasons I do a lot of work with Zinzino. And I love this company because they offer a special patient program where you can test, correct, and then retest for free. And I put all the information for that on the side there. And they've done over 1 million tests globally, but they analyze their US data, and only about 2% of people in the USA are optimally balanced between omega-6 and omega-3. And there's a lot of things that affects, from cell membrane health to impaired brain function, cardiovascular things, beauty, pain. So, you name it. This is a great test to see what's actually going on, because just because you're taking some fish oil doesn't mean that your body's actually assimilating it. And the way that the balance oil is made, it's a patented method of extraction of the fish oil, and it actually extracts it so your body receives it more as a food, and then that substance is resuspended in a super rich polyphenol oil, and there's also some vitamin D3 added for really good absorption. And you can see just amazing results. This is one of my clients. He waited a little bit longer than the 120 days to retest, but 120 days is how long it takes your red blood cells to regenerate. So that is a great timing to retest. So here you could see his index was off, his mental strength was off, and that goes back to that brain inflammation, because what that marker, and this is actually just a cover page of the test. There's a lot more fatty acids that they test and a lot more markers that they test, but I just wanted to give you an idea. So when the brain does not have enough omega-3, it will then use omega-6, which is great because you're still functioning, but that's super inflammatory. And that's when the brain problems really start happening. So you could use this 2-drop blood sample. This is the test right here. It just comes in a box that's this big. And it gets sent away in the mail, and then it goes into a FedEx envelope and goes to Norway, because that's where they're based. And they use VITAS, which is an independent chemical analysis lab, the top one in Europe. And that's where they do all this anonymous testing, which is great. And you really want to get 3-to-1 or lower, because that's the threshold where inflammation stops. So, even a 6-to-1, you're not there. And I see a lot of people, even 45-to-1. These are, very scary numbers in a cardiac world as well, very scary numbers. So back to fuel delivery and energy. So starved cells produce less energy, so reduced ATP happening. And I like to use glutathione because that's a master antioxidant. And I also love to use Adrenal Max if that is the right thing for the person. And the 2 screenshots here from the tests are from the Dutch Plus test. So this top one here is the cortisol awakening response. And this is a really interesting test because you can see in that shaded area, that's where everyone should be landing for a proper cortisol awakening response. So when you come in the morning, you should be nice and low because you were low cortisol at night, God willing. And then in the first half hour, your cortisol jumps up 70 to 80%. You can see that big jump in the first 30 minutes. And that's such an important flush of cortisol because it's actually flushing out all of your inflammation and turning your brain on. So you can see this poor person is having a really sluggish start and is now riddled in inflammation. The next half hour, it goes down 30-40%. And then after that, it slowly goes down all day where she's actually in line to get ready to sleep again. So when I see this cortisol awakening response being off, I'm really looking at the HPA axis, the hypothalamus adrenal axis. And I'm also looking at cortisol, and this is also the Dutch test. This is this bottom image right here. So this not only shows the creation of cortisol, but how it's metabolized in the body. So someone could be making enough, but then it gets changed to cortisone. So you can see the systemic preference bar on the bottom here, cortisone versus cortisol, the THF versus the THE. And here, I also like to look at this before I work with licorice with people. So the adrenal max has licorice. If this person was keeping everything in cortisol and she took licorice, she would actually get heart palpitations and have some anxiety. So it's really important to monitor people when you're giving them licorice. And this also shows the cortisol clearance rate. So these are really interesting ways to look at things. And this is also how the Dutch test looks at hormones. It's not just what is that hormone in your blood at that moment. It's the creation, the transportation, the utilization, and how your body's clearing it out. Because if it's not clearing it out properly, then everything is getting reabsorbed and recirculated. And that gives messages to your brain that turns all of the levels a little funky, so to speak. The other test that I really love to do with looking at ATP and minerals is the hair tissue mineral analysis. And this is a really interesting test because you're looking at minerals. And last month, our talk was minerals are the sparks of life. Thank you, Zuzu. And here you can see like how important that is. Because when you do the HDMA ratio analysis, you look at ratios between different minerals, like calcium to magnesium shows blood sugar. I wrote these on the bottom of the slide, calcium, potassium, thyroid, and et cetera, et cetera. So this person here has perhaps a blood sugar problem or an insulin sensitivity problem. So I would definitely look at them on CGM and the Keto Mojo. The thyroid is very hypothyroid, so this is something also we want to work on as soon as possible, but you just support it in the beginning because the thyroid is never really the problem, it's the victim. So you can't really do that until you get further up the pyramid or the roadmap. Adrenals are running very low. Vitality is an inverse relationship, so running very low. There's some hormonal stress. So, these are really interesting ways to look at it. And this isn't a very expensive test, so it's a nice thing to do. So I like to look at what my patient can actually do monetarily and time-wise and effort-wise, and that's how I choose some of my testing. So this is oxidative stress. So oxidative stress damages blood vessels and it impairs the body's ability to deliver fuel and even make fuel. So one of the products I really love using is Protandim. There's loads of really amazing research studies on there on PubMed. I have a link so that you guys can look at that later. But this is thermography before and after a 3-month Protandim. So this first one is cardiac. You can actually see there was a cardiac issue and then it was gone. Here you could see there was a dental issue, gone. Here you can see a reproductive health issue, gone. And right here in the center, you would look at thyroid. And that has really, the fire has gone out in the thyroid quite well. A lot of this other red is lymph, so there still needs to be some work done there. These are the same person. It's a 56-year-old female. And this was her, on the right, her Uroxy test, which is an oxidative stress test before the 3 months and after the 3 months. I mean, that's just incredible. And the physician's lab comprehensive metabolic performance profile on the left, those numbers are all based on 30-year-olds. So when you look at the bottom right of that slide and hers is in the green, she has the oxidative stress of a 30-year-old after 3 months of using this protocol. This is the protocol she was on. You can also just do the 3 blue bottles, but this is actually what she has on, and these all work very synergistically. But the NRF1 is the main thing that has a lot of research. It supports ATP and cellular energy. NRF2 supports detoxification and reduces oxidative stress. And the NAD, I think the most important thing there is that it does autophagy. So as your cells are working, they can die off. And you need to be able to clear those out. Autophagy is sort of like cellular cellular house cleaning. So that's why this is such a great support to oxidative stress and fuel delivery in your body. And you can see oxidative stress can show up as fatigue, brain fog, muscle or joint pain, wrinkles, gray hair, decreased eyesight, headaches, sensitivity to noise. I mean, all sorts of things. And it plays a major role in all sorts of disease. So I put the link there for the clinical trial and also the protocol, and you can download a sheet of all the links after the presentation. Another thing I like to work on for fuel delivery is PEMF. So PEMF was actually invented in 1881 by Nikola Tesla, and it went through several different times of being swept under the rug, but really a lot of athletes use it because it makes healing go much quicker in muscles, joints, and even broken bones. It's even used for cancer patients, and it's a very expensive machine. They run between 6,000 and 30,000. But in January of this year, a company named Life, who started in Malaysia 6 years ago and then also brought it to Europe, has now a home PEMF, and it is really strong, and it combines with terahertz. And you can see in this slide enhanced circulation and oxygenation, cell regeneration and repair, pain reduction. I mean, just amazing things. And it's even on an energetic way. It's a grounding energy, and it can even balance chakras. So, depending on how you run your practice, you can talk about all these different things. And there's also a link here that you can see 3 videos, and also look at buying it for your practice, because this is a great way to offer that service, and people can even get one from you and use it at home, because daily use is very supportive. Okay, now we're talking about the liver. The liver and the gallbladder, really, really important in digestion. And I like to look at the GI map because I can see things there. I like to look at serum labs. And then I also like to look at the Dutch test. And there's another slide from Dutch here. And it's sort of like another part of what the liver does, which is the methylation activity of methylizing your neurotransmitters and your hormones, specifically estrogen, through your liver. And if you have a genetic SNP like COMT, that methylation activity can be extremely low. And if it is low, a great thing to take is SAMe. So that also supports joint and methylation health, but it helps that feedback loop of estrogen, because if the estrogen isn't actually able to leave the body, it then recirculates, and that won't show up on serum testing. But the item that will know about it is your brain. And now all of a sudden it's shutting down estrogen production because it senses there's too much, but it's not actually very useful. So this is a really interesting way. And also the Dutch test looks at the hydroxylation of estrogen, and it goes down 3 different pathways that are on the bottom right there. 2-OHE1 is this pathway, which is actually good. The 16-OHE1, which is moderately good, but you really don't want to be going down the 4-OHE1 because that is a cancer-causing pathway, and it destroys DNA with the reactive quinones. And if that is happening, you really don't want to give anyone any exogenous hormones before you shift that pathway to the 2-OHE1 and check the methylation activity. So before I do any hormone work with people, I really love to do that Dutch test. Other things I look at for the liver are the mycotoxin test, if they've done that, because there's certain strains of molds that are really hepatotoxic. And I also like to do a physical inspection. So there's some things that I look at. This is more towards gallbladder function, and on the GI map that can be seen as steatocrit. But also, I like to look at people's bowel movements and really talk about that. So I give them a Bristol stool chart so they can better describe to me, but I also have them comment on color, mucus, odor, floating or sinking, difficulty passing. If the bowel movements are floating, there's not enough bile. So is it a sludgy bile duct from from an estrogen problem, or what's going on here. Again, the production or the blockage. So we need to work on that from that angle. And here is where alpha gest 3 comes in handy again with that ox bile. And in general, the liver, kidney, spleen health products, KSL Enviro and K Plus, are also great to bring in as a support here. The other thing that I had mentioned on the slide here is the 5 F's of gallbladder risk. And that's a great thing to think about when you're seeing your clients. Female, fat or having a high body weight, fertile or having been pregnant, 40 or older, and fair or a family history of gallbladder problems. So these are things that you can look at with testing and just with some asking about symptoms and monitoring stool and seeing what the family history is. Last but not least, amino acids are necessary for phase 2 liver detoxification. So if there's a lack of amino acids, the liver is also going to have some problems. And all of this goes through to microbial fermentation and short-chain fatty acids we'll be talking more about. But I love the Mega Protein Mid-L Plus because they do such a good job with the aminos. It's a great clean source of protein. So this is a super product to use as support. All right, so now we've done fuel delivery and we're on to immune function. We're talking about leaky gut, inflammation, infections, even how the vaginal microbiome and the gut microbiome interact, and immunity issues and autoimmunity. So here we're looking at some of the tests that I look at. The GI map, which maps out the gut microbiome, and it's a very interesting test because it doesn't just look at the bacteria, so to speak. It's a DNR. It's a DNA PCR test, meaning they're actually looking for the DNA leftovers of things, because especially if you're looking for parasites, some parasites, when they die, their exoskeleton has an enzyme and they digest themselves away. So they're actually gone. And that can be very frustrating when you're looking at a normal stool test from your typical doctor's office. So this is a really amazing way they do that. The EVI maps out the vaginal microbiome. Those two microbiomes are connected. So you really want to look. I usually start with some home testing with some strips for pH and for UTI. UTI just for men and for women, and of course pH just for women. But if someone has BV or anything else going on, you really want to make that happen at the same time. And then when you get the GI map, you can compare some of the good and bad microbes that are happening there. So I actually developed a program that does a weighted analysis of GI maps. And I do more looking at the systems and how the systems are impacted rather than looking at an exact bacteria and just dealing with that exact bacteria. I want to see how the whole thing comes together. So I'm going to show you GI map and I'm going to show you my weighted analysis. So this is the pathogens page, and the E. coli is on here, which is a whole different thing that needs to be very carefully analyzed because there's E. coli that's not bad and there's E. coli that's happening in Africa right now. So that's a very important differentiation. H. pylori comes up a lot, and there's different virulence factors, and all those have to be considered in treatment. The commensal keystone bacteria. So this is a great shot of what the gut is actually doing. And if you see someone that has a lot of markers on the left side where they're all red, that means they have a compressed microbiome. And they're going to have a lot of oomph problems with getting food digested, and even on a metabolic way, it really affects how the blood sugar is dealt with in the body. So I've seen some very interesting things. So if I want to correct someone's blood sugar, but they have a compressed microbiome, I can only do so much. I can do some lifestyle things and really teach them with the continuous glucose monitor what their lifestyle is doing to their glucose. So they don't spike their glucose as much, but it'll automatically start getting better as I deal with some of these microbiome compression issues. Opportunistic overgrowth bacteria. I see a lot of staph and strep. Here on the bottom of the page, you also have candida. Candida is a really difficult one because it can be so systemic in so many different places. So when you're looking at it here, it's really looking at, is the candida in the lower part of your digestive tract? I do some home testing to see if it's in the sinus, oral, and upper digestive tract. And we can also look at serum and organic oat testing as well. But it can be very difficult. I like to use the home testing to monitor so that I can keep my treatment going until it's finally gone. And it's really interesting because I had someone that was having problems getting in ketosis, and I tested her candida, and lo and behold, her candida was still around. And when candida does not have glucose to eat, it eats ketones. So good luck getting your ketones up if you have candida. This is the parasite page. Obviously, there's many more parasites um, that are listed here, but these are very common ones, and there's some that you treat harshly, and there's some that you don't have to treat as much, but it's really good to know. And this is one of the best tests, hands down, for parasites. The bottom panel here is really interesting. You have the steatocrit looking at your gallbladder function. You have the lastase looking at your pancreatic enzyme function. You have your beta-glucuronidase, which can show some estrogen dominance if it's high. Occult blood is if there's blood in the stool. So I also continue to monitor with home tests. And if I do see something this high, I do send the patient out to get a colonoscopy because that needs to be dealt with and really looked at carefully. Secretory IgA can either be high or low, and both are bad, and they get treated differently. And sometimes if you see the eosinophil activation protein this high, even though there's no parasites, there's a good chance the parasite there or a viral infection. So you have to dig a little deeper. Calprotectin shows inflammation window, and zonulin is your master leaky gut junction marker. So, we see here what's going on. This is the antibiotic resistance of the H. pylori, not of the person. So I don't use antibiotics for H. pylori, but if a practitioner does, they always have to pay attention to this page because they wouldn't want to give the person an antibiotic that isn't even going to work for the resistance. So this is now my weighted sample output. It's 4 pages long. So systemic homeostasis, that's the microbiome compression and the oxidative stress that we talked about, hormone and metabolic markers, estrogen dominance or hormone imbalance, insulin sensitivity, and the omega polyphenol need and how it combines to all of that. And you can see this is actually the analysis of the GI map we looked at, so you can see each analyte under each section. Immunity, autoimmune, or immune system activation. So do I need to attenuate that immune system? And there's some other things that that you can look at on this to tell you more about how much you need to worry about that immune system. This is the inflammation picture of the patient before, so you can see how inflamed that person is, how many markers refer to inflammation there. Gut barrier integrity. So on the bottom left there, you have zonulin, which we talked about. But if there's Enterococcus species, those actually make a small intestine leaky. So this person is leaky from the top to the bottom. And even the bacteria debts, which make up 70% of the microbiome, they're low. So that shows you another reason that it's leaky. So the butyrate, the anaerobes, and the mucosal are the other layers of the gut. You have the atmospheric layer of the gut, the mucosal layer of the gut, and even the immune layer of the gut, besides just the actual junctions. And I like to also look at how the skin's being involved, because skin inside and skin outside do play a role together. And then I'm really looking at their dysbiosis and infection. And you cannot analyze SIBO directly from a GI map, but I like to look at the species that are involved in SIBO, and you can sort of see here, well, this person has 4 markers that are SIBO. So as I do my kill, I'm gonna look at it in a little bit more of a SIBO way rather than just dysbiosis. And there is some fungal dysbiosis going on as well, so that's another hint for candida. And looking at infection and looking at liver support that's needed. The gut imbalance, these are all digestive dysfunction, dysbiosis markers, and digestive insufficiency markers, meaning stomach acid or pancreatic enzymes or bile. So, we know we need to look at all of those things very carefully. And here's some more immune reactivity stuff. So we're looking at MAST, we're looking at LPS, we're looking at histamine, we're also looking at gram-negative bacteria and how those are all interacting. So you can see on the right there's a lot of MAST markers, and there's a lot of histamine markers on the left and the right. So there's some attenuation that needs to be done here. And then I also like to look like we were talking about the EVI, the bowel and the bladder, what's going on with the bloating, what's going on with the constipation versus diarrhea, and what analytes could possibly be causing urinary tract infections. So when I do my full report, it actually gives protocol suggestions to the practitioner. It gives lifestyle and nutrition guidance to the patients, because I'm really big on lifestyle things as well. And there's also a full written analysis of all the collective functions for your presentation to your client. So these are really amazing things. And I also include all the research for each analyte and a glossary of all the functional pathways. So if you want to hand the whole 20, 30-page report to your client, you can. So let's talk about this immune testing, and rather the gut testing, and how the new modern way of looking at the microbiome is. Like I mentioned before, it's not looking at one bacteria. It's rather looking at what the whole microbiome is doing and how the output is affecting system-wide effects. And one of the pioneers of this is Dr. Paul Clayton. He's working with Zenzino on the board now, and they are the pioneers of test-based personalized nutrition. And I love this, and he's a firm believer that this is the way of the future, that we're able to test, correct, and then retest. And I'm a big fan of that, and that's why I do bring some of these products into my practice. And this is his new gut health test. It's also 2 blood drops done at home, and then it's sent off in the mail, and then to Norway to that independent laboratory, and everything's anonymous. So the way that Dr. Paul worked on this test for Zenzino is that it has 5 key health markers. So like a gut index overall score, and then the IPA level, which is indole propionic acid, and the KYN, which is the kyuranine, and also the tryptophan. And these are all different ratios that show immune support, gut microbiome efficiency, and even stress indicators, how that's going on how that's responding to your microbiome. So I love this simple test. And if I see someone that doesn't have loads of very bad GI symptoms, but they want to optimize, this is a great way to do it. This is another patient testing program where you get the test, you do their xenobiotic, which is an amazing 8 natural dietary fibers and prebiotics. It's a really good balance, and then you can retest again. So it's a really great optimization tool. Yeah, and check out Dr. Paul Clayton's blog. He's really incredible. He worked for the UK government for food and nutrition, and he's now here in Florida, an hour north of me, so I'm really excited that I get to work with him so often. All right, now we're moving on to the number 3 on our pyramid, detox and cleanse. So now that we've worked on the gut and sealed the leaky gut, which is the most important part, because if you have leaky gut, there's a really high chance that you also have leaky brain, and you do not want to be pulling out metals or molds or mycotoxins or any extreme toxins while that's going on. So this is the time where we really look at our detox functions again and make sure everything is really ready to go. I'd like to use infrared saunas to really get that sweating going. And when you look at your lymph system, movement and sweating are key. So you can consider PEMF, you can consider lymphatic draining machines. There's also lymphatic exercises. And I like the lymphatic drainer, which is from Standard Enzyme, which is on the top right. And then I also really make sure that my clients have good posture and are breathing right, because if you're not breathing right, it throws everything off in your body, from your digestion to your pelvic floor, and your lungs aren't, if you're not expelling all of your carbon dioxide, when you're breathing back in, you're not even getting enough oxygen. So all of those things work together so much. And again, we're looking at bowel movements here. And I love those fiber balance capsules because they do have the fiber in them, but they also have all the different herbs that act on any sort of constipation. And instead of just doing pills for that, I like to make sure that people are hydrating properly. And I use the calculation of half of your body weight is the ounces you should be drinking. So if you're 200 pounds, you should be drinking 100 ounces of water a day, plus 20 ounces for every hour of exercising or sweating. And I even do things like the wind relieving pose, which is a yoga pose that's been proven for centuries. And you lay on a hard surface like the floor or the yoga mat and put your knees into your chest and roll around a little bit. And it's like acupressure or acupuncture that helps your body release wind, but also gets your bowels moving. And if someone is actually having too many bowel movements or is loose, then I really look at the short chain fatty acid balance in their lower gut, because that can really help anything for bloating or for loose stools. Okay, now we're on neuro and endo. And the reason that these are way up on the top is, like I said before, your thyroid is not the problem, it is the victim. And the hormones and the brain stand for that as well for many instances. So for hormones, I look at serum labs, even though they're just spot labs, but I like to use those before and after some of my more expensive tests so I could just monitor. The Dutch Plus test is definitely one of my favorite. I've shown you a couple slides of that. Mira is really interesting. This is the Mira machine. It's a little egg-shaped machine, and you do your first morning urine, and then there's a testing stick, and you stick it right in there, and it gives you lab quality estrogen, progesterone, LH, and FSH, and then it maps it for you on your app and on the website, and it shows the whole ballet of what's going on with the hormones. Now it's time for the estrogen to come up, and now the estrogen goes down, and now the progesterone comes down, and now the LH spikes. Like, what is that ballet, and is it off? Because if the ballet is off, you can't really even time the Dutch test right. So sometimes I use Mira to see the ballet so I can time the correct sample day for Dutch. And I also, again, use Evi if needed, because if your vaginal microbiome is off, it's going to affect the whole balance of your system. And for thyroid, I'm a big believer in not just looking at labs, because if you look at a lab for, let's say, TSH, the TSH could be 3, which in the allopathic world is A-okay. But the problem is that there could be masking going on. So if there's any blood sugar issues, if as people age, it changes. And once all of those things are an infection, if the infection and the blood sugar are dealt with, and then you do the serum labs again, well, all of a sudden the TSH could be 9, which is bad. But that's actually unmasked. So it's a little difficult. And I also don't like to just look at TSH. I have a panel of 6 different analytes that I test to make sure I can see the whole balance, and I do some ratio work there as well. But I find it's very important to do symptom tracking and basal temperature and pulse. And Broda Barnes in the 1930s developed that whole system of looking at basal temperature and pulse to analyze thyroid function. And basically, if you're under 97 for basal temperature in the first thing in the morning, then that's a marker for hyperthyroidism. I really love all the standard enzyme thyroid support collection. So that's a great one for you to look at. I often open up the PDF catalog and I just type thyroid, and then all the 30 different things that have thyroid support in them come up, and I can design from there. So going back to the brain, if the brain is now getting good fuel, and but there's still some issues, this is a good time to do a neural zoomer plus. And so that measures the antibodies to evaluate immune reactivity, neuroinflammation, blood-brain barrier integrity, and you can really diagnose a lot of things out of that. Dr. Stephen Zanfini from Zanfini Wellness Center is amazing at analyzing this test. So here we are, optimization, peak performance, resilience, vibrant health and longevity. And one of my favorite quote, make your health span match your lifespan. Because who wants a long lifespan if you don't have the health span to support that? So here I like to look at general ongoing support. So I really tell my patients about lifestyle and diet considerations. I consider any GI supplements at that time, rotating different probiotics and prebiotics and fibers. And then I also really love, I have a bottle here, the Vitamin Complete from Standard Enzyme, because it's a perfect broad spectrum of vitamins, minerals, antioxidants, and they also have it based in a full spectrum colloidal trace minerals. And that way you really get an amazing amount of trace minerals in there. So that's a great way to handle some ongoing support. And if I'm working with someone and they're really still having some problems, the Diadren Forte is great because it's targeted support for metabolic and glandular wellness. And it also helps, manage stress and things like that. It's a really nice support for adrenal to liver to gallbladder to pancreas. So that's a great thing. And then, if this person needs a little more work, so if they hadn't done some of the tests and things are still happening, we might want to revisit some of those things at that point. But I love having people optimized and just giving them the smallest amount possible to keep them there. So that is my conclusion, and the key takeaway I want for all of you is knowing that chronic health challenges are rarely a single organ issue. It's always a systemic response to a toxic, inflamed internal environment. So that's why you really want to look at the fuel delivery, because the fuel delivery is also the detoxability. And really, the call to action here is follow the roadmap to build to optimization. If you do things out of order, it's not going to be optimal for the patient. And on the bottom there, I have all my contact information, which is also on the sheet that you can download. You can just go to my website, arteetra.com, and there's also a practitioner tab there of ways that we can work together. But that is what I do in a nutshell. Trey, back to you.
I feel like we're tossing the news, from the field reporter back to the news. Uh, so thank you for that. And Arte Etra, is that correct?
Yes,
Because I totally butchered it at the beginning.
close enough. It's all good. It's all about the art of being well. And and a reason I chose that name, it's a palindrome, is because sometimes you look at something, but it's actually just the opposite of what you should be looking at. You really need to look at all the root causes and figure out the correct path forward.
I love that. I would not have noticed that that was a palindrome had you not said that. That is
Forwards and
amazing.
backwards, exactly the same.
That's right. So, folks, let's go ahead and get in your questions. You can use that drop down tab for questions, or you can utilize uh, the chat feature as well. But I do have some questions that I've already received. I want to go ahead and make sure to ask some of these. Um, so, Andrea, how do you prioritize the root cause roadmap when a patient has abnormalities in several areas at the same time?
That's a great question. I love that. So, as I was saying, there's some things that are sort of connected. So if someone has a microbiome compression, then I'm going to have a hard time correcting their blood sugar 100% beforehand. And really, it's all about getting information. So really looking at the symptoms of that person, and those symptoms will point to you where you need to start. But I always like to really make sure that my detox is in check first, as much as possible, and then another wave of detox before I get any heavy metals or mycotoxins out of the systems, or extreme toxins. Uh, so that's really it. Just looking at the symptoms and letting that guide you. And also looking at, what the person can afford to do, because some of this stuff, it takes a long time for the gut to heal, because truly to heal leaky gut, it takes 2 years. Although with my roadmap, I've gotten that cut down to 1 for most people, and that way we can move forward. But it does add up with all the testing and the supplements, and that's why I lean hard on lifestyle and on home testing, and continually asking for revised symptoms and looking at bowel movements too.
Excellent, excellent. Uh, we did have a comment that came across, and they said, I just want to say that this has been the best presentation this year. Um,
Thank you. I love that. It's definitely my passion. I love this stuff, and I live and breathe it.
ex- Excellent. So here's another question that did come across. How do you distinguish clinically meaningful GI map findings from organisms that may simply be present without causing symptoms? Does that make sense?
Well, that's a really interesting question, because sometimes there's, let's say there'll be a norovirus, well, but there's no symptoms, or there'll be E. coli, which is maybe not the kind from Africa, but if there's no symptoms, you don't have to go so crazy with the kill. And that's also looking at the mysterious candida overgrowth. If those symptoms keep on coming, then you need to hit it harder, even though it's hard to see on some tests. So it's looking at the actual organism and looking at the symptoms together that can tell you what the road forward should be.
Okay, excellent. I loved also, some of the feedback that you were saying. Again, it just goes back to the difference between the allopathic and the holistic, is that, every person is an individual, as opposed to, being able to look at somebody and their issues, through the same lens. Like, when you're talking about thyroid, sometimes you can't just go by the TSH report. You've got to look at other indicators before you just start throwing them on medicines and stuff like that. So that was excellent. Um,
Awesome. I love that.
got another question.
Wow, I've
When
got
you
a lot of good questions here. Thank you, everyone.
Keep them coming. When you see signs of inflammation, intestinal permeability, and dysbiosis and immune activation together, what determines the order of intervention?
Well, I mean, I'm going to go all the way back to my roadmap so we can have that in front of us. I need the first one, of course. A lot of slides. Here we go. All right. So if we have everything, um, the you definitely want to make sure the fuel delivery is happening so that the body has strength to deal with it. And then looking at the GI map is a great place to look at for inflammation. So looking at the weighted results of like how strong that inflammation is will tell you how hard you have to hit that, and also from what angle. So if someone has low short chain fatty acids and low butyrate, um, then I would use that as a part of my attenuation for the inflammation. However, if that is not a part of it, then I would perhaps lean towards more of a turmeric curcumin route. So those are the types of things that you could really see on the weighted report of the GI map that can lead you in that right direction.
Awesome. Think I've got one more right now. Let's see. How could a physician or other practitioner work with you as an integrated holistic analyst, or, learning how to maintain their own diagnostic and treatment? Many of our folks have, different diagnostic hardware and software that they use, called a CSA or an EDS technology, where they do testing. But I think sometimes they're missing out on, maybe the nutritional side. Certainly that's one of your major um, uh, experience and different things. So how can they work with you or to do a better job at servicing their folks?
So I'll answer that in two stages. The one part is like just looking specifically at nutrition, like how to improve that. So obviously, from a health coaching standpoint, teaching people about food and drink and activity is really important. And then putting perhaps a CGM on them and making sure that they're not frying themselves metabolically speaking is very helpful. Um, but then as well, looking at test results. So you can see those kind of things on the GI map and the Dutch tests. So for, let's say, digestion and nutrition. So the person might be eating enough protein, but if they don't have the things they need in place to digest that, it's not going to happen. And you can actually see the result of that on the Dutch test because the VMA and the HVMA are going to be low at that point. And then they need to pick up the protein, but then I test their stomach acid and make sure that the protein they're actually having is going into their system. So, those are the kinds of things that I could work with practitioners to help them weed out what they should focus on with the client. But from a standpoint of also helping is to be able to do the GI map and doing that full analysis because that really, really helps and guiding people through the EVI test and the MIRA test for hormones is a key part as well. And really looking at the mycotoxins. And I've also done a lot of work with Lyme, which is its own challenge. And fuel delivery is a really important part to start there as well. So I have a lot of different tests and analysis and functions that I can help practitioners with. And I could even meet with their clients and be their health coach on staff. I work like different ways with Zanfini Wellness Center like that. It works out really nicely.
That's awesome. Okay. I oop, looks like I've got another one. Uh-oh. Let's see. This one is there a budgetary cascade for the testing for ability to prepare a client for cost? I think I know what he's saying. Basically, is there a way basically to prepare that customer for the cost of different testings and because
Yeah, I mean, so what I usually do is I have a folder together that shows an example of some of the test results, an example of what the protocols might look like and for how long and how much they are, so that people can really um, decide which way they're able to go. If are they able to put the work in? Are they able to put the money in to do, the Cadillac version, or do we want to go with a lesser version and support the body as best we can to do the healing? And that's why I do a lot of the free testing and a lot of the lifestyle tests, a lot of the lifestyle steps to help people, and nutrition, of course, to help people be able to afford healing. Of course, when you test everything, then you know exactly what you need and you can be very pinpointed and very efficient. But the body is an incredible healing machine. So there's a lot of different ways to slice that cake. So I like to get a good idea of what my client is ready to do in those circumstances.
certainly, yeah. We have with our some of our technicians who utilize the testing software. They'll find that they start focusing on one particular area, and then as that area is improving, all of a sudden the others are falling behind, and improving because they're addressing a root cause or a root issue, and so it's allowing the body to heal better, which is just tremendous to me. The body is an amazing thing.
And
uh,
especially if you set it up with this pyramid where it's nice and strong on the bottom, now the body can actually do its job that you're asking it to do and praying for it to do.
yes, absolutely. Well, I think that is going to be it for tonight for the questions and
Fantastic.
everything.
I
I,
just
you
wanted to
know,
thank everyone for hanging in there with the technical difficulties. I really appreciate it, and I hope you got a lot of great information and food for thought in my talk.
yeah, absolutely. I know I did. We certainly had somebody who provided their thoughts and feelings as well. We appreciate you doing this, and for your first time with us, we really appreciate your flexibility as we threw you that big old massive curveball.
I was so sad. I was like, no, don't let people leave.
So we'll get to the bottom of what that issue was, and we'll also investigate a maybe a better hoster at this time, because it definitely seems like they certainly have some issues. Um, but we appreciate you joining us. We appreciate you being here and giving us your time. We'd love to have you back again.
Yeah,
And
we have lots of more things to discuss from the roadmap, don't we? I mean,
absolutely,
it can be days and days.
I think that is so true. That is so true. So, guys, thank you again. Thank you, attendees, and everybody who joined us this evening. Thank you, Sam, for your help and helping us do a little tap dance there as we came back as well. And we wish everybody a wonderful evening and a good night. So, thank you, guys.
Good night, everyone. Thank you.
Thank you.